health. 40 teams of students from across the nation are in Lagos State for a 3-day creative research engagement at the Nigerian Institute of Medical Research to join the government agency in finding solutions to communicable and non-communicable diseases in the country. The Research Institute, in collaboration with international partners, is optimistic the students will creatively come up with community-based applicable solutions that will save lives. Senior correspondent Jacqueline Ogo reports.
About 5 years ago, no one knew that HIV test kits will be widely available in Nigeria, and the use embraced by many who fear stigmatization through testing for the virus publicly. With that being a successful feat, the Nigerian Institute of Medical Research, in its 2024 Mega Design-a-thon program, is engaging students on creative community-based solutions to curb the spread of HIV, cervical cancer, hepatitis B in babies, and the use of soothing music to curb hypertension. Researchers from the United States, including Nigerian American doctors and professors who fled to greener pastures, are part of the Youth for Youth creative research collaboration.
It's not enough to go elsewhere and say, let's imbibe other people's food, other people's culture, when we know what works for us. And so that's why we are gathered, to ask people in general, what are those solutions for increasing HPV vaccination? Do you know what will work there so that more girls, for example, will vaccinate? Please bring it.
The Director General of NIMR did not fail to mention the need for the creation of an institute that caters to research funding.
To improve the health research in Nigeria, to improve our health system, to provide data and solutions to the myriads of health challenges that we have, we needed to have a special agency funding specifically health research in the country.
The students are optimistic their research outcomes will save lives.
My team and I are not just there. We've worked together on several solutions, so we hope to be able to do this on a grand scheme.
We are also working on a system, a network system that would make HIV self-testing more accessible and widely used by the at-risk youth in our society.
Communicable and non-communicable diseases are the major reasons for deaths across the world. Here in Nigeria, the Institute of Medical Research is engaging youths to ensure that they use their creative ideas to drive up solutions that will keep lives on the lines of safety. Jacqueline Ogo, TVC News, Lagos.
More on the creative research engagement, a lecturer at the School of Medicine, Washington University, Dr. Juliet Ewendomo, joins me on the news. Thanks for joining us on the news at 10. Tell us more about NIMR's collaboration with local and international partners to engage the students in coming up with these research, that is able to help Nigeria's health sector.
Right. So if you know much about research, it's oftentimes the experts have ideas, they bring it to the communities and tell people what to do. I think here we have an opportunity to say, no, this time around, community members, young people, what ideas do you have for health research? And can we partner with you to lead change? And so there are 4 different projects we're doing simultaneously where we believe solutions can come from the ground up with young people, with everyone actually leading the way. If you think of any experiences you may have had with high blood pressure in your family, with stroke in your family, cancer, particularly cervical cancer. My sister-in-law, Angie, passed away 2 years ago here in Nigeria with cervical cancer, or even just liver cancer. Any experience you may have had touches you personally that you feel you may be able to have solutions to prevent it. We're not necessarily treated. How can we, in other words, create more awareness that are homegrown, locally, from the bottom up to help with solutions? That's what we're here asking our youth, our community members to give us solutions that can hopefully, end the scourge of some of these diseases in Nigeria.
So don't you think this same agenda can actually be promoted among Nigerian students overseas, or are you only considering Nigerians here, back home?
It's actually for Nigerians, by Nigerians, and so the burden is here, so like 1 in 3 Nigerian, for example, has stroke and will die if we don't get, enough prevention or awareness to it. The burden is here, and the goal is that together, if our creativity, for example, the example I often use is our music. Our music is local, it's creative. If our music is local and creative, can our health issues also be local and creative, but built from our community members, from our young people, from the ground up? And so because the issues are here, because we have high burdens of diseases here, we want to tap into the assets of our young people to say, can we change that for good to maybe drive solutions to some of these pressing health issues that are currently in Nigeria? I'm Nigerian by birth, born and raised here in Nigeria. Yes, I do work as a professor at Washington University in St. Louis, but the goal of it is to be able to say that there's brain gain when many more Nigerians are interested in coming home to work with Nigerians collectively, collaboratively, particularly with the work we do at NIMR to co-create solutions that are homegrown to address and tackle our own health issues together.
And just before we let you go, will the students get rewarded for their efforts? Maybe, work with the research team?
Building. Yes, the whole idea is capacity building, and not just building Nigeria and it ends. There's going to be a boot camp that is going to occur in the summer where, again, they get to work with the Nigerian Institute of Medical Research, and the ideas they develop ultimately will be piloted for the benefits of Nigerians.
Thank you very much. Dr. Juliet Iwelumo is a lecturer at the School of Medicine. Thank you for talking to us on TVC News at 10.
Bye.